So let's talk about this case in point, ransomware. I think that ransomware is going to evolve further in 2017. It is on two tracks, basically. The targeted style attacks on organizations with high availability requirements have really upticked. There are also, though, the mass attacks via ransomware-as-a-service. So there's cheap and easy ransomware attacks that pretty much anybody with a few $1,000s can get into on the dark web and start running these against consumers or businesses who sort of random targets, kind of a spray and pray approach to infecting people with ransomware. But then there are the targeted advanced persistent threat style attacks where people are being chosen as a target. They're being researched and surveilled as a target with the goal of getting into the organization's systems and carrying out a persistent attack. And part of that used to be for stealing patient data, stealing potentially intellectual property for resale. But now it's like, oh, we're in here, we've got access, let's ransom the critical data. And the criticality of systems and data in healthcare, which, as I've argued, is in some ways greater than other sectors, makes them a prime target. I want to just address the downside of paying up. It's important to realize that paying up on ransomware does not guarantee you're going to get your files back. One of the main reasons for that is that the malware is not necessarily that good. The malware industry does its testing live. So we see this time and again where a new piece of ransomware comes out and it's not working properly. It might have disclosed its keys, and so it isn't effective that way. But also, and this one here, encryption ransomware hits Mac OS. We wrote this up on We Live Security. WeLiveSecurity.com, by the way, is where the ESET researchers publish their findings. And this ransomware didn't work. You couldn't, even if you paid them, they couldn't give you your stuff back. The encryption was broken, and it was only one way. Also, I've heard from a number of people, organizations where they have paid, and they got hit again. All right, so this is a classic criminal pattern. Burglary falls in patterns like this. Burglars go through a neighborhood, they do well, they come back. And then it perpetuates the crime. If nobody paid the ransomware, and we were all in position to do that, then it would dry up. And so I need to make the claim that ransomware is not unbeatable, because we see this. We see people using good anti-malware, appropriately configured, actually fending off ransomware effectively. This means it's got to be done right. Cloud updates are an important part of this. What we're seeing is a massive amount of data sharing amongst security companies, amongst people like Google or Microsoft, the antivirus companies, the web browser companies, and so on. Sharing in real time news about new ransomware. So if you're getting cloud updates for your security system, it's going to know within almost real time that there's a new strain out there. And of course, some anti-malware can identify something it's never seen before as ransomware and block it. However, the last best line of defense is good backup and recovery. And again, two key things here. You can say, oh, well, you need good backup and recovery. Well, we just used to say you need good backup. Now I include recovery because people tend to back up without checking every so often whether it's working or not, and full coverage. So talked to a number of organizations in the last 12 months who got hit by ransomware on a particular server or a particular project that wasn't included in the full organizational backup and recovery program. And so you do need to include everything, even the latest projects, and you need to test it. You need an anti-ransomware strategy. Employee education around this topic can really help you stop the damage, limit the damage. Vendors can help. ESET has a number of key recovery programs available, tools that can be used. So check with your security vendor. Hey, we've been hit by this particular kind of ransomware. Do you have the keys for it? Can you help us get it back? Do that certainly before you just turn over money to the bad guys. And your incident response plan needs to include a ransomware scenario. All right? Most responsible organizations have an incident response plan, but they tend to let it sit on the shelf. Have you got a ransomware scenario in there? Do you have ransomware policy? Who in your organization has access to the Bitcoin account if you have to pay in an emergency situation? Do all your employees know to whom they should speak if they see a ransomware warning on their machine? And does everybody know not to pay it without checking with the person you've designated in your organization to manage that scenario? And so you need this strategy.